Good morning, everyone. Welcome to today's webinar, Move Beyond ROI to Show True Value. I wanted just to kick off this morning with a little housekeeping. Wanted to make sure that everyone can hear us. If you're having any difficulties, feel free to just text us through chat. As well, we're going to host a Q&A at the end of today's webinar, so please submit your questions in the chat box. So hopefully everyone is connected. We welcome everyone. We're excited about this topic today because we get asked by many companies, what's the best way to show impact for their well-being initiatives? At Aduro, we've come up with a model that shows the true value and that it's more than just financial savings and gain. My name is Matthew Duncan. I'm the lead here at Aduro's marketing, and I'll also be your moderator today. If we meet our objectives, you should walk away with a couple key learnings. Number one, a better understanding of VOI or value on investment and why it means more than ROI, how to measure employee engagement intensity, and how to present a model that makes sense to your leadership. I'm pleased to introduce our panel of experts in the field of impact analysis and well-being. First, Dean Davison, a principal consultant at Forrester Research, where he serves B2B professionals. He has an extensive experience in the buy side of technology, advising customers in purchasing and implementing solutions. Welcome, Dean.
Thanks, Matthew. It's great to be here.
Glad to have you aboard. In addition, I have Renee Petrie. She is the Vice President of Healthcare Strategy here at Aduro. She's a leader in the field of digital health with more than 25 years of experience. She focuses on helping customers expand and transform their health programs through better engagement, technology innovation, patient-centered solutions to complement their clinical workflows. Welcome, Renee.
Thank you, Matthew. It's a pleasure.
Glad to have you here as well. So I thought I'd start off by just giving a little background on Aduro for those of you that might not be familiar with the work that we do. We call ourselves a human performance company because we're hyper obsessed about the transformation away from wellness into well-being, or even more importantly, into this idea of human performance, which is just a much more inclusive and fun way to unlock the potential in individuals and organizations. At the end of the day, we're in the business of behavior change for both individuals and organizations. Our approach starts with one, the individual, the employee, the patient, the team member, the ninja, whatever you might call them. And we know that this individual is very complex. They have varying interests throughout the year. Some focus on health opportunities, others financial opportunities, some are wanting to give back. But at Aduro, we have a proven model that is transformative through the power of choice, empowering people to be great at anything. We define human performance through 4 interconnected life areas. Those are health and fitness, money and prosperity, growth and development, and contribution and sustainability. So in this example, you'll see Carol is most interested in reducing her debt, followed then by getting better sleep, being less wasteful, and taking on a leadership role at work. So we fundamentally believe it's important to meet Carol with the things that she cares about first before we nudge her towards the areas that she needs help in. And we understand as HR leaders and benefit leaders that at the end of the day, it's important to measure these investments, which as we define value on investment through the lens of engagement, culture, and economics for a valued impact. And we're going to walk you through that structure today. So without further ado, would love to get into sort of how all these pieces work in our model, we have often have conversations with our clients who are realizing change in many ways across their organization and within their culture. But we fundamentally decided we needed an independent third-party validation, a different perspective to make sure that the form of our model is right within the market and within where our customers want to focus on, and a tool to really help them measure that and keep on measuring that through years forward. So we've partnered with Forrester. We're happy to have engaged them, and specifically Dean led the research and the model. And I'd love to pass it over to you, Dean, to walk us through exactly that research and what you concluded.
Thanks so much, Matthew, and to everyone on the call. It's great to join Aduro today to tell this story. As it shows on the next slide, I want to share with you a couple of thoughts. First of all, I want to take a couple of minutes and walk through Forrester's methodology. What is a total economic impact study? And give you a little bit of a framework for that. What's our approach and our methodology? Then we'll talk about some things the customers actually said. What did those people tell Forrester? And then I'll share with you basically the math. How did we calculate an ROI and what type of results did we come up with? And throughout all of this, I want to emphasize that I'm sharing the experience that these customers shared with Forrester. It's also important to note, as you see there on the right, that this is an abbreviated presentation that is extracted from a more comprehensive study. And you can get that full study from Aduro. I believe Aduro is going to post a link to that or give you that to you during this call so that you can go get that. But the more comprehensive study gives you a way to compare it to your organization. It's designed for you to be able to look at what we found in the study, compare it to your organization, and input the information. And we'll talk a little bit about that as we work through the deck. But first of all, what is a TEI? On the next slide, you see that there are 4 different components. One is benefits and costs. Those are pretty straightforward in any kind of a financial study. In Forrester's methodology, we look at direct benefits and costs, which would be something that earned you money or saved you money or cost you money, an actual cash outlay or income generation. At the same time, we look at the indirect benefits and costs. In other words, what are for example, a benefit might be improved productivity of people. A cost might be a team of people who spent some time working on a project. We also look at something called flexibility, which is a way we categorize benefits that came downstream, things that happened in future years that maybe and often weren't even anticipated at the time of the initial decision and yet still benefited the organization. And then lastly, Forrester risk adjusts this. So how do we go through this process? On the next slide, you'll see that Forrester walks through a due diligence process. We spend time talking with Aduro. We spend time talking with those who are in the industry to be able to have an understanding of how they approach this. And so what you see is we at Forrester don't try to impose our understanding, our structure, our point of view on Aduro's customers. We spend time talking with people like Matthew and Renee to understand those customers. And then we do go out and actually interview those customers. And once we've interviewed those customers, then we take the analysis of what they've said and we build a financial model. There you go. So you can see those stages, and then we turn that into a written case study. One final housekeeping note on my side before we jump forward, that's on the next slide, is a few disclosures. Forrester came in as an independent and objective provider to do an analysis, to basically validate what Aduro was feeling and seeing about itself, but to do so in an objective sense. Our methodology is meant to protect that independence. So although the customers that we interviewed were provided or introduced to us by Aduro, Forrester went through the interviews, we conducted those, the analysis remains that of Forrester, and that this in no way implies any type of an endorsement of Aduro. But with that, let me share with you some of the excellent things that the customers had to say. First of all, the general state of things before working with Aduro was that the companies had a number of employees who were unaware of their health benefits, or they weren't engaged in basic programs. One of the organizations said, we were very tactical in our benefit decisions, and our executive over human resources wanted to become more strategic. And so this became part of a program to change the way that they manage this. The result was that after engaging with Aduro, they were able to successfully engage with employees, increase dramatically, I'll add, well-being program participation, as well as have indirect benefits of things like employee retention and some very significant improvements in medical and prescription claim costs that resulted in some significant savings for the organization. So let's jump forward and take another step into what we found in this study and the analysis we found. Real quickly though, what Forrester found and the amount that we did in our calculations was that the organizations realized a return on investment of working with Aduro of 182%, and that they had a payback from their investment and all of the effort in standing up a program that included Aduro of less than 6 months. So let's talk a little bit about how we came to that analysis and how we reached that. So let's talk a little bit more about what the customers told us, where they were and how they achieved this benefit. So on the next slide, you see a few items on the left that talk about some of the problems that they were having. These organizations had low employee awareness, sometimes of health benefits. In fact, one of the benefits that was shared in one of the interviews was simple awareness of what the benefits that the employees already had. They just weren't aware of them and they weren't taking advantage of them. They were paying excessive fees for employee health care. And it covers both medical and prescription claims. And we'll talk about how they drove that down. And that there also was a significant increase, well, there it is, in prescriptions. As they rolled out Aduro, though, they found that Aduro, and I want to add here, this is an important note throughout this presentation and study, that most of these organizations, or the ones that we interviewed, were running more comprehensive programs for employee awareness, engagement, healthcare, well-being, and various types of human performance and well-being type programs. Aduro was part of that arsenal. And so these organizations used Aduro as both a platform and as a program to help facilitate the types of changes they wanted. And so you'll see when we get into calculations in a little bit that we don't attribute all of the financial benefits necessarily just to Aduro, but that we break them up. And I'll explain that in a little more detail. But basically, there was a significant boost in employee engagement. There was a reduction in both medical and pharmaceutical spending per employee, and they were able to move upstream and have more of a value-based relationship, things that resulted in reduced workman's comp claims, in reduced employee turnover, increase in employee engagement, and other types of things that changed the overall workplace, rather than simply saying we saved a little bit of money or we made a little bit of money. So on the next slide, a couple of quotes that begin to share that sentiment. One organization said in the first year, 93% of our employees covered on our health plan did a screening and health assessment. Another company that we interviewed said we looked at 22 vendors and Aduro came out on top. One of the things is their flexibility and nimbleness. I won't read that whole quote, but the one on the right, what's interesting is this was, as you can see at the bottom, a large healthcare organization that had hospitals and clinics and had to work with a number of different unions that had negotiated agreements with, for example, doctors as one group, nurses as another group, facilities management people as yet a different group, and technicians. And so they had, in their case, 6 different legal definitions of groups and different benefit structures that they had to help manage. And one of the things that they said is no other vendor except Aduro brought to the table the ability to simultaneously integrate these programs into a single platform and yet maintain the individuality of the legal programs that our union structure and our employee structure required us to maintain. So let's continue on to the next slide and talk in a little bit more detail about how we did some of this math. Basically, what Forrester found in the interviews is that there were 3 distinct benefits. The first one that we were able to measure was an increase in employee retention. And I'll show you how we calculated that in just a minute as we drill down into each of these. The next two are very similar to each other. There was a reduced growth in the cost of medical claims. Medical claims had been increasing at a certain percentage per year, and they were able to reduce that growth. The same thing with the reduced growth in prescription claims. That they were able to do that and bring down that cost. So let's go on to the next slide and drill into each of these individually and talk about them a little bit more. So the first thing that we measured is that there was this increase an increase in employee retention or a decrease in turnover. Some of that came from health. Employees were healthier. They were doing more things. They were getting more active. They were running. They were avoiding chronic illnesses and other types of programs that sometimes impeded health. There were some employees who basically. Well, let me say this a different way. This is based on an organization that has 10,000 employees. And as I mentioned earlier, the purpose of the more comprehensive study that you can get from Aduro is that it shows all of the calculations, it shows all of the math, and that you can go back to that and say, well, we're only an organization of 2,000 employees, or we're an organization of 20,000 employees. And you can take the assumptions and the calculations and modify that to say, okay, if I get this benefit, just like these other customers did that Forrester interviewed, here's what the level of impact is that I should expect on my organization. And basically, for a 10,000 person organization, they reduced their turnover by 0.5% per year, which means that every year for a 10,000 person organization, they didn't need to hire 50 more people at a fairly high average cost, because we are talking about some expensive people here. And so we risk adjusted that, and the total savings over 3 years was $1.7 million. And as I talked about earlier, one of the real pieces of this employee retention was not only increasingly engaged employees, but there were other activities such as safety programs and the ability to reduce the number of workmen's compensation programs, which put employees out of work or out of commission for a period of time. So there's a lot of variables that come into this employee retention, but comprehensively, that's the first benefit we were able to quantify. The second benefit that we were able to talk about is medical claims. Now, this one and the next slide that we're going to talk about in just a minute are very similar. So you'll see a similar approach to the math. So we'll spend a little more time on this one and then go through the next one a little more quickly. But basically, the organization was growing before Aduro and before they started their well-being programs. Their cost of medical claims was increasing at 6% per year. Now, of the companies that I interviewed, some were much higher than that. Some were much lower than that. One of them had been running at 12% per year. One of them was running at sub 2% per year. So there's a lot of variation, and that's one more reason that having that comprehensive study is available for you so that you can adapt it to your specific needs. What they found, though, is that on average, for a 6% growth in medical claims, that after running all of these programs and activities, they were able to reduce that rate of increase every year to just 2% per year. So what Forrester basically calculated is they said, well, we started at we were paying $52 million a year in the first year, and we projected out the $52 million growing at 6%, and we projected out the $52 million growing at 2%. And we took the difference, which was a much higher number than 3.7 million, because as I said earlier, these companies were all running different programs. They were running other types of employee awareness, other types of well-being programs, education programs, other ways to engage employees. So there was more to this than just using Aduro as a platform and as a partner to help drive well-being and improve human performance. So we asked these executives, how much of the value of medical claims would you attribute just to the Aduro component of your relationship? And what they told us on average was about 40%. So we took the savings from the medical costs and we attributed 40% of that to Aduro, which took us to $3.7 million. The next slide is very similar, as I said a minute ago. And it's the same type of idea, only with prescription claims, that there was a certain growth rate and that growth rate in cost decreased. And in this case, the organizations attributed about 60% of that to Aduro. And again, the prescription claims came from a couple of different things. Some of that was increasing employee awareness about the value of using generic medications rather than brand names. It also came from helping drive preventative programs that kept employees from needing medications. For example, one of the interviews, the organization told us that they ran well eating programs and other types of healthfulness, and that they decreased the rate of metabolic syndrome among the employees that were being tested by 4.4% over a 2-year period. So again, as we start to reduce the average metabolic syndrome, we start to avoid things like perhaps diabetes or other types of downstream illnesses that cost a lot in prescription claims. Real quickly, lastly, there are a couple of benefits that we were not able to measure on the next slide. Some of these are things like that employees they became aware that they had benefits. We talked about that earlier. Hard to measure the value of that, and improved awareness of the personal health among employees. Many employees just didn't have a good awareness of what their health status was. Yeah, they knew that maybe they were eating a little too much, or they knew they were overweight, or they knew that they were still smoking, or they knew that they weren't perfect. But this gave them a data-driven way to be aware of that and to start to manage their risk toward poor health and avoiding it. So all this did cost some money, however. It wasn't free. And on the next slide, we show you very quickly that there were some costs involved. There was a cost to the Aduro platform, which averaged for the platform itself, some of the coaching programs and other activities, averaged about $66 per employee per year. And each of the organizations also ran different types of incentive programs. They would do everything from giving a gift card for people who come and have their metabolic rates tested. And by the way, a lot of the organizations we spoke to also included spouses in these programs. But one organization actually had a drawing, and of those who would participate and have their data collected on a regular basis, they had a drawing for among those employees where there was, I believe it was a 7-day all paid vacation to a resort in some exotic location. So there were some really cool incentives, and those incentives played an important part in motivating employees to be actively engaged. To wrap up, I want to share with you 2 thoughts. One is this is the way we did the calculations. This is the way we did the math, and we're able to come up with a 182% ROI and a payback of less than 6 months. But for many organizations, the benefits that they shared with us, some of the things that they couldn't measure were just as important, if not more important, than the things we did measure. And so, keep in mind that this ROI is some things can't be reduced to a business case. Lastly, just a couple more quotes to wrap up the stories that these customers told us at Forrester. One, we are seeing a greater than 3-to-1 return on our program. And then the endorsement that I wish I could get endorsements like this about my work every day of the week. But what is Aduro's role in our overarching health strategy? It's invaluable. It is truly foundational for what we do. It's the launching point. So again, these are the results of an independent and objective viewpoint to come in and validate what Aduro was hearing from its customers, and try to really work on how to run well-being programs and increase human performance in your organizations. And that's what we found. Matthew, back to you.
Yes, thank you, Dean. I think that was a great foundation to your research and your model. We appreciate that. So with that said, Renee, how does Aduro think about engagement and the value it brings to organizations?
So Matthew, that's a great question. And, let me build the foundation for answering that question by taking a moment to talk about our approach to transformational habit change. So, as you noted at the beginning of the webinar, Aduro is in the business of changing behaviors and positively impacting individuals and the organizations that they work for. And hopefully, as the participants today have noticed, we do take a different approach to traditional wellness. where traditional wellness is typically focused on individuals as a health risk or a health problem, and incentives that focus on short-term actions rather than lasting change. So at Aduro, we're really striving to focus on the whole person, and this idea of meeting that individual where they are on their journey and then engaging them and supporting them in their pursuit of their individual goals and, of their vision of what it means to live a better life. So we do this through this science-based approach, which is transformative, as you noted, through the power of choice, and really designed around this model that starts with activation and engagement, and then centers in on this concept that we call the ignite moment. So this ignite moment not only gives individuals the choice and the opportunity to focus on what's most important to them, but it also centers on this concept of intrinsic motivation, or that person's individual reason for change. And through Ignite, we're aligning to what's most important to the individual, and we tap into that intrinsic motivation to really power their pursuit of their personalized goals. And then once we have them connected to that reason and start to build momentum, we make sure that we're surrounding that individual with all of the information that they need, all of the tools that they need, all of the resources that they need to begin to build and practice habits. And then most importantly, to start experiencing and reinforcing their small wins and ultimately begin realizing lasting change. So, I wanted to take a few minutes to share with you some of our results when it comes to engagement.
Great.
So, as I mentioned, our transformational habit change really starts with engaging users in the program or activating users. And we know that the vast majority of employers today are investing in well-being solutions for their employee populations. And we also know from some of the recent research that when you ask employers why they're investing, 3 out of 4 employers are prioritizing culture and well-being over this question, how do I reduce my health cost? Excuse me. So I think this really recognizes the value that, a thriving and a culturally aligned program has to the organization. And when we look at engagement rates among employees in our programs over the past 4 years, as you can see here, we see really high levels of engagement, with 67% of employees registering to take part in the program and nearly 70% among our larger clients. So interest in a more comprehensive well-being program is growing and strong. It's growing and strong among employers, and it's growing and strong among employees as well. So engagement in our programs often starts with the basic program requirements, like our well-being assessment. And so here we're also seeing really high levels of engagement among registered participants, with 72% of registered participants on average completing their annual assessment, which is well above industry average for programs that include incentives. And then as Dean noted in his review, some of our organizations, like one that participated in that review, are seeing engagement in the well-being assessments as high as, I think he said 92% or 93%. So that's amazing. And so, we're activating people, we're engaging people, but I think this is where things, start to get really interesting, with individuals moving from what you hear people in the industry referring to as little e engagement. So right now, registering and taking part in the program requirements like the well-being assessment, to what we call big E engagement or engagement intensity. So when we look at our programs, our human performance programs, those Be Great at Anything paths and programs that Matthew mentioned, we're engaging individuals in programs that are aligned to their personal interests and their reason for change, and we're seeing massive growth in that level of engagement. So on the left here, you see, when we look at Q1, sort of a cross-section in time over the last 3 years, we have nearly a 300% increase in engagements in our programs, delivered through webinar sessions, one-on-one coaching, and digital practices. And on the right, that's putting us on track to reach about 5 million engagements by the end of the year. So we're really, really encouraged to see such high engagement and that our programs are really resonating with the individuals that we're serving. And this does bring us back to Aduro's human performance approach to well-being. And just to reiterate, as Matthew said, centers on these 4 interconnected life areas. So what we see on this slide is the distribution across our whole population in these 4 life areas. So far this year in 2018, as individuals start to dive deeper into paths and practices, we're seeing about 50% are engaging in programs that are centered on health and fitness. And that's not surprising. We know that resonates with a big portion of the population. But more importantly, the other 50% is engaging somewhere else. They're focusing on those areas like personal growth and professional development, budget basics, money and prosperity, or contributions and sustainability. And what I have, there on the right is our top 10 programs in 2018. And as you can see, in the far right column, it's pretty consistent, top programs in 2018 and 2017. So these programs are really resonating with individuals. The exception in 2018 is you'll see a couple of programs, Budget Basics and Dream Big, 2 of our money and prosperity programs have now made it into the top 10 or technically the top 11. And I think that really reflects the growing interest among our participants in financial well-being. We also see in some of the top programs, emotional well-being being an area of interest, things like mindfulness and resilience. So I'm just going to say, at the core, this is really central to our approach and to why clients choose to work with us. If you want to meet the needs of your entire population, you need a comprehensive approach to well-being. And that's what Be Great at Anything is all about. But we also know, with that said, and even with that passion, that outcomes matter too, right? And so when we drill down and look at the impact of some of our health outcomes focused programs, we're making a difference. I've highlighted a couple of programs here from our pre-diabetes program and our smoking cessation program, and some of the key results on the right-hand side. So the proof is in the numbers. When we look at our diabetes prevention programs, we see 54% of participants improve 1 or more medicine risk factors or pre-diabetes risk factors. We see that about 31%, so almost a third of participants, meet their weight loss target or goal of 4% weight loss or more. And in our smoking cessation program, Breathe Easy, we recently did a 4-year look-back analysis of participants who took part in the program in 2014 and for whom we still had a validated measure of tobacco-free status 4 years later. And 44% of individuals who took part in Breathe Easy were still tobacco-free 4 years later. And just to put that data point into context, research data shows that 7% of smokers manage to quit for 6 months or longer without the help of a program like Breathe Easy. So we're really proud of the results that we're achieving there. So we're impacting, individual health, we're improving overall well-being, and we also know from the research that improved well-being, as Dean noted, has that, less hard ROI, more difficult to measure impact on the organization as well. We know that individuals who report having a higher well-being also feel more engaged at work, they enjoy work more, they're more loyal to their teams, they're more likely to recommend the organization, and they're less likely to leave. So all of these things are really, really important to our HR leaders and our benefits leaders for the organizations that we work with. Most importantly, at the end of the day, our clients and our participants, they love us. From a technology perspective, to our biometric screenings, our Wellmetrics events, to our programs that we deliver, and even our account managers, we get high marks and rave reviews across the board. And we're, just thankful to have the opportunity to help individuals and these organizations be great at anything. So hopefully that's helpful.
Yeah, thank you, Renee.
Yeah,
I think it's great how you illustrated that based off the model and the results that you guys are getting in the book of business.
Terrific.
I guess I want to conclude. Thank you both for that discussion. I want to conclude by just talking about, so at the end of the day, what does a scorecard look like? The model that we discussed today is being formed into what we're calling a human performance scorecard for customers to use in 2019 as a measurement and a benchmark for their programs with Aduro. So we were not only pushing forth these models, but we're trying to deliver that in a more comprehensive way to track and measure the success. So at this point in time, I'd like to invite again people to ask questions through the chat. We'd love to get a discussion going here for the rest of our time today. There are a couple that have already come through that I want to throw out. I think this one ties back into your discussion, Renee. What was the baseline used to quantify employee engagement?
Yeah, so I think that we're focusing on looking at engagement really in two ways. Again, sort of as I referenced, the small e engagement, the big E engagement. And so the first way we look at it is just engagement in the program. Are they registering? Are they completing the program requirements? And what does engagement look like at that level? And we shared some findings with regard to that. And then the second way we look at it is really this concept of engagement intensity. How do we start people on the journey? And then how do we keep engaging them through our programs? And we see, again, amazing growth in both of those areas.
Yes. Another question that actually just came in. How was employee satisfaction, engagement, enjoyment measured?
So we have a couple of different ways. If the employee satisfaction is related to the rave reviews, kind of the results that we shared, we have several different ways to measure employee satisfaction with the overall program. We pulse them on an ongoing basis as they're participating in the engagement platform. So a random sample of individuals are asked on an ongoing basis to tell us how satisfied they are with that. All of the participants who go through our biometric Wellmetrics screening events are asked to rate their satisfaction with that event. We take that rating very seriously. And then within all of our programs as well, each and every session that an individual completes, we ask them to provide a rating on their satisfaction with the program. And then, of course, our clients, we assess their satisfaction with our account management service and our program twice a year.
Great, great. Another question, what do you attribute the higher assessment engagement from your larger clients?
That's a great question. I would say that, we see a lot of our larger clients really investing in a comprehensive approach to well-being. And when I say that, I don't mean just as investing in Aduro. I mean, they're really investing at their organizational level too. Kind of moving from, as Dean referenced, this tactical focus to this strategic focus. So making sure that they're really integrating the well-being program, Aduro's program, into their culture, their organization, giving it the leadership support, the organizational support to make it really resonate with their individual employees. And I think that has a huge impact. We can bring, again, all of the information, tools, and resources to engage that individual, but it's going to be more impactful when the organizations kind of come at it with the same attention, interest, and intensity that we do. And I think that's what we see with a lot of our larger employers.
Great. Dean, there's a couple of questions here just around the calculation of cost savings and attribution of those costs. They're very specifically, people are asking around when you looked at the cost for Aduro and then the cost for incentives, was there also within your model a cost line for payroll for those 10,000 life groups?
Was there a line item for payroll?
Yeah, so I guess the question is trying to get to sort of what was the average cost per employee?
So when we did that, we tried to simplify the model, because in the first place, we're taking and creating a single financial model that spans the experience of a number of different companies, which has its own inherent complexity. So the way we do that is, rather than tracking, for example, the average salary per employee, we create a framework or a model, and that's why I kept referring back to the more comprehensive study that you as listeners can get from Aduro, to see the table and the assumptions we made. In your case, it may be that there is a decline or a lower growth rate in the cost per employee. And you would have to build that into your version of a spreadsheet. But in our case for this, we simply used one flat rate and used that over 3 years. So we didn't account for raises or inflation or anything like that in this model.
Great. Thank you very much. Another question here is that the measurement from Aduro can be provided to all clients for metabolic changes in metabolic syndrome compared to other models. And so just to speak to that, I think Renee highlighted some of the impact that we are seeing in programs like Revive, which is diabetes prevention. And yes, we have the ability to report on and track and measure your organization's cohort relative to participants in that program. We also look at that vis-a-vis what the CDC and other sort of institutions are looking at for maintaining or avoiding diabetes. So that is part of a comprehensive. You want to speak?
Yeah, that's right. Yeah, no, I think that's right. It's for clients who, the vast majority of our clients are leveraging our biometric Wellmetrics events to capture those biometric measures on an annual basis. Mm-hmm. And as part of our standard reporting that we do at the end of the year for clients, we're providing them with that information at a population level, so they have that cross-sectional view of their population at that moment in time and what their overall risk profile looks like, which is really, really helpful in terms of thinking about how do you align your program to the opportunities and the risks that you see within your population, how you make it resonate with the things that are most needed or most important to individuals. And then as part of our standard end of year reporting, we also provide a cohort analysis on the biometric data so that you can look at individuals who participated in the program year over year and how are we impacting overall health risks. And one piece of that is reporting on metabolic syndrome and sort of the risk migration. How is that changing, for each client's population? So yes, that's part of the standard reporting.
Excellent. Another question probes into this idea around new programs of content that are coming in 2018 and moving forward. Yeah. So what are some of the topics that might be available?
Yeah, that's a great question. When I talk, it's definitely about our Be Great at Anything programs. I use the word thriving quite a bit. I think it's important that the WellBeing program overall is thriving and connected into culture. And likewise, I think one of the differentiators for Aduro is its ability to introduce new content into the program on an ongoing basis and keep it alive and interesting for our participants. What we look at when we decide what content we want to bring into or new programs we want to Be Great at Anything programs we want to bring into the experience is where are the demands and interests that we're seeing among our end users. And so that's one of the reasons we look at our top 10 programs. That's one of the reasons that we ask participants each year in the program through our program called Roadmap to Success, what matters most to them when it comes to well-being and what areas do they want to focus on. And we're clearly seeing two themes emerging The first is around financial well-being, and the second one is around mental health and emotional well-being. And so those are going to be two core focus areas. Continuing in 2018 and even more so into 2019, we have some really exciting developments as an organization that we'll be focusing on in those two areas. So those areas, as well as continuing to, strengthen up some of our, or add additional content into some of our, the other two life areas.
Great. That's exciting. A couple more questions and then we'll have to wrap here. There's definitely a question around sort of what portion of training or participation is on site, in person versus online, self-paced.
Yeah.
I think, fundamentally, let's address that by talking about in Aduro's program, we think about that from digital to human.
Yeah.
Right. So that's all the way from self-guided through our app. Individuals are able to participate in paths and practices and habits in a self-guided multi-digital format. We have an asynchronous component, which allows people to interchange in a convenient ways with coaches. And then we also have, of course, and we always will have, a very important live one-on-one connection with a coach. We see that 62% success rate once someone actually engages with a coach. And then that translates to Onsite. So we're seeing an uptick in organizations that are looking for like on-site coordination and coaching to bring that into their sort of on-site, near-site clinics. So we definitely span that total spectrum of engagement. Let's see. Beyond budgeting, what other financial wellness services are planned to be offered?
Good question. So, it's interesting when we select these different terms for labels for these 4 life areas that we focus on. You'll see 2 things like health and fitness and money and prosperity. And so that sort of reflects our focus in that program content area as well. Money, suggests more around budgeting basics, right? And that type of focus. Prosperity, on the other hand, really sort of looks forward to your long-term financial health and long-term planning. And so our program development in the area of financial well-being will focus on both of those areas and continuing to bring in new programming and content related to that. We're actually piloting right now here at Aduro through our program that we call Fiscal Fire, some of the content to test it with our own internal employees. We call them ninjas, and getting really just fantastic reviews of that program, which will be rolling out into our larger book of business. So again, focusing on both those areas, not just the budgeting fundamentals, but really long-term planning as well.
Excellent. I think we hit our time limit, so I'm going to just wrap it up. I want to thank everyone that participated. We will be following up with a email and access to the recorded webinar. We'll also be highlighting the link as to the Forrester report on value on investment, so that will be there. You will also find a variety of different information and contact on adurolife.com. We thank you very much for your time and patience. Dean, thank you very much for all the great work that you did from Forrester and your participation today. Renee, thank you so much for your time and energy that you brought. And we wish you all a great day.
Thanks, everyone. Thanks, Matthew.